Good morning, everyone. Bob Ravenscroft, Vice President for Advancement here for our November 12th media briefing. There's a lot of information from some advanced questions that came in and information to share with you, so bear with me today. First of all, a couple of announcements. Next week, we will be hosting briefings on Tuesday, Wednesday, and Thursday. Wednesday, we will give a COVID update, as we usually do, but we're also going to share some really fantastic news, and it would have been the type of thing that our media friends would have been covering in earnest in non-COVID days, so we hope you can make time available at 11 o'clock on Wednesday for a COVID update and then a special announcement. And then we are also evaluating going back to 3 times a week for these updates. We're going to reach out to some of the media members that have been following this closely from the beginning and see if that would be helpful before making that final decision. But some of you expect a phone call from us. Real quickly, our midnight census was 566. We have now administered 30,977 COVID-19 tests, and that has resulted in 3,953 positives here at Bryan. Right now we have 347 pending tests, which has been a little higher. Don't have a good reason for you. We have increased our drive-through hours so we can accommodate 144 patients a day. It is now open from Tuesday and it'll carry through Saturday from 8:45 to noon. I think that's probably a little bit of that, and then also as things start to back up in reference labs as the pandemic rages throughout the Midwest is a big part of that as well. But nothing about extended ones, just more pendings than we were accustomed to seeing recently. The number of COVID-19 patients currently at Bryan Medical Center now is 121 patients. 42 of them are from Lancaster County. 79 of them are from other counties throughout Nebraska. There is an additional 10 patients that are still hospitalized, but no longer infectious. Additionally, there are 16 other patients in-house that are pending their result, and all but 3 of those 16 are from Lancaster County. The number of patients on ventilators with a positive test at this point in time are 13. 1 of them is from Lancaster County, and 12 of them are from outside of Lancaster County. And additionally, in that no longer infectious category, unfortunately, 5 of these patients are still on vents. Of our COVID patients, 17 are in the intensive care unit, and then 5 of the no longer infectious are still occupying intensive care beds as well. This is actually going to be covered much more thoroughly in an upcoming briefing that will include personnel from our pharmacy department and physicians, but I can share a few things. Yes, Bryan is one of the 5 distribution sites in Nebraska, and there are indications that we could receive our first batch of the vaccine yet this year by the end of the year, and boy, are we happy about that. I'm not sure if North Platte, I'm assuming they are, as part of the Pfizer group, is all in one of the 5 in the state, but rest assured, we'd be on the same timetable they would if they are indeed. I don't know what Mel or someone from North Platte said about this, but regarding the coolers, we purchased them immediately upon the release of information from Pfizer and Moderna regarding the cold storage requirements that their vaccine would need. I don't recall if that was in late August or in September, but they've been here. They've been sitting in our warehouse, and they have now been transported to our campuses and are being readied for use. Basically, what's going on now is hooking them up and doing a lot of testing on the temperature tracking controls. These aren't your normal freezers. They require storage at minus 70 degrees Celsius, plus or minus 10 degrees. So these are really robust freezers. We are waiting on some additional supplies for them, and basically this is protective gear, so you can touch things that are minus 70 degrees safely. And we do have information a little bit more about how these will be administered. And what I'm talking about here is needle size, where you're going to get poked in the body, and so forth. Different needle size based on the size of the human receiving the vaccine. So really right now we're just waiting on the distribution and knowing what the count will be. There are distribution plans in place on who goes first, who goes second, and so forth. What we don't know yet is, for instance, if say we get 1,000 doses, does that mean it's doses for 1,000 people because it's a 2-dose vaccine? Or do those 1,000 doses essentially get divided by 2, so it's for 500? But everything we're reading, it's the same stuff you are reading, that in 2021 it will be, flooding the country, which cannot come soon enough. Well, first of all, I think we would agree with Dr. Lawler. We are seeing for our own eyes, everybody in the state that cares to watch is seeing the exponential growth of this. I think for the past 7.5 months from this podium and our physicians, we have been imploring Nebraskans to do all they can to help blunt the spread. I also believe we've been foreboding that it could be a tough winter. It's very discouraging, and it's very discouraging that large swaths of the population have chosen to ignore this, and we are indeed in a tough spot, really tough spots. Regarding how much we can handle, to be determined, to be frank with you, work continues on how we can better utilize some of the convalescent beds that are available in the state. And we're working with telemedicine operations so we can perhaps deliver some care in people's homes, certainly in long-term care and throughout critical access hospitals. Bryan Telemedicine and our intensivist hat is off to them. Basically, we're throwing everything we can at this. We do continue to reassign units. Just yesterday, we added 8 additional airborne isolation units for COVID patients and 8 more general care beds. Those 8 general care beds is moving some of our 8 beds that were in senior mental health available for general care. So in the past day, we've essentially added 16 beds to respond to COVID. In 2020, we have added 40 beds throughout Bryan. This is in addition to the repurposing of existing beds. I thought I would give you a glimpse, too, to bring some color to this. What I have here is the minutes from a daily call that includes 42 leaders throughout the organization, physicians, senior leaders, clinical, and support leaders, and it is our pandemic preparedness and response meeting. Again, this happens every day, 42 people. The topics that are covered is yesterday, update from the state health department. There's about 1 page of updates coming from the state. Topic is on mobile testing and drive-through. Then we get into page 3 and we're talking about a lab update, and that's consistent. And then on page 3, all the way through page 4, are updates on our inpatient volume status. So here's some highlights or lowlights from that we can share with. And I only pulled out a couple to share with you because there's just too much here. But yesterday afternoon when we had this call, it was reported the West ED is at capacity, looking ahead to surgery schedules to see what alleviation that can bring. Senior mental health beds, as just mentioned, had been prepared for a med-surg unit, or is being prepared. Next COVID expansion considerations will be West 5 South and then pediatrics on East. We can't complete those changes until some of the patients are discharged. Our West ED was holding 2 severely ill patients, 1 approaching 44 hours as we work for beds to clear up to move them to a more advanced level of care. We're bringing additional training to the ED nurses to handle the additional acuity. We still had, at that point in time of the meeting, 19 admissions to place. East Campus had some dismissals. There was hope we could move West ED boarders, what we call them, those that are waiting, over to East. Our East ICUs were full. East ED was better than West. We only had 20 patients and a handful of boarders. There are COVID patients in other isolation negative pressure rooms, and we're continuing our efforts to move them to airborne isolation units. Additional VersaFlow PAPRs will be shipped on Friday, working with our environmental services team to get them up and ready. And then last of, again, I probably am giving you 10, 15 updates of 40 or 50 from this section of the agenda. Our float pool, it's nurses that can float throughout the organization, typically for routine things that come in through the night. Of the 6 that were on call the previous night, 5 of them were pulled for COVID surge, leaving 1 nurse to fill all of the other openings coming in. So there you have it, guys. It's a lot of moving parts that occurs daily. I think some of that was just covered, but yes, they are safely segregated either in isolation rooms, reverse airflow rooms, or if they're in general care units. Entrance to those rooms is incredibly restricted, and personal protective equipment is utilized on both the patient and the staff. So we do believe it is safe. And yes, indeed, there are waits in our ED room. Through the kind of the recap of the minutes, you're seeing that the severity of illness in those patients is much greater than is typical in an emergency department, and they are indeed staying in our emergency department for extended periods of time. When do we start? As soon as they arrive. The priority is all being worked out right now, and they would be done at the hospital here. That's really not a concern, Andrew, any more than it routinely is. The work that our pharmacy does, frankly, on a daily basis to work with drug suppliers, and they monitor shortages throughout the world. Honestly, I think I'm probably stepping out above my pay grade here, but there could be some alleviation of that as the electives and surgeries are pulled back. It might even decrease the need. We're getting everything we need to treat COVID patients right now. That's very personal decisions. There is information. Is it up on our website now? Yeah, there's information up on our website with a bunch of helpful tips. It's really hard for families, and you want to see their face. You want to hug and kiss them, but if they're coming from somewhere and they're not in your pod, we strongly encourage you respecting distance and wear masks. We're smoking ribs and turkey outside so we can, do it that way. And our group's small, 3, maybe 4 people. But yeah, we can't stress it enough to be careful for yourself and for your family. We've covered the asymptomatic nature of transmission, ad nauseum for 7.5 months. It's real, and do everything you can to protect your family, and don't be bashful about asking them to respect your concerns. I don't know if there's been any declining of transfers that I'm aware of. Our general practice is no, not to do that. I know you guys, especially the Lincoln Journal-Star, is really magnifying what's going on in rural counties, and we thank it. It's kind of a little sneak preview. We have produced a pretty direct public service announcement that we are going to flood the state with to implore them to help us out. What I do know is our critical access hospitals are taking care of many more COVID patients than they ever would have imagined at the beginning of this. Thankfully, our intensivists through telemedicine are helping them, and they're doing everything they can keep them. I don't know how you answer that question on where you get to declining transfers when people are ill. We will do everything we can with unit movement so patients don't have to experience that if they need care at Bryan.